Heads up, this podcast isn't therapy. It's bold, blunt, and irreverent, but it's not a substitute for professional help. Full disclaimer is in the blurb below. So today I'm going to do a Psyche and Cycle episode on PCOS. So I want to take it beyond the myths and the misery. And again, just a little disclaimer, I'm giving you an overview. Your decisions are your own. Please consult your doctor. This is just to give you an overview of the different pieces of information that I have learned from the ladies in my practice. And it's so important. I feel for every woman with this particular issue, but your choices have to be your own, and do your own research, due diligence, and talk to your doctor. So PCOS isn't just irregular periods and a few cysts on the ovaries, it's an endocrine hurricane. It's the hair you pluck in secret from your chin before a date. It's the exhaustion you can't explain to your boss, and it's the acne that makes you feel 15 when you're 35 or 40. And it's the doctor who dismisses you with casual, just lose some weight. Now, a lot of doctors are so kind, but a lot of ladies have said that that's been, asked of them. So PCOS isn't vanity, it isn't laziness, and it's not a lack of discipline. Oh, it's a survival roller coaster. It's living in a body that's metabolically, hormonally, and emotionally complex, and often completely misunderstood. So I just want to break it down. I'll try to give you an overview of the science, the psyche, and the lived reality of PCOS. We'll debunk some myths, explore treatments, and empower you to advocate for yourself. So, what is PCOS? Let's start with the basics. PCOS stands for Polycystic Ovary Syndrome. But here's the first thing to know. It's not just an ovary problem, it's a full body hormonal and metabolic condition that affects up to 10 to 13% of women of reproductive age worldwide. Let that sink in. That's a lot of people. So doctors diagnose PCOS using the Rotterdam criteria. If you have at least two of these three things, irregular or absent ovulation, higher levels of androgens, those so-called male hormones like testosterone, and polycystic looking ovaries on an ultrasound, some women have all three, some have just two. So here's the kicker. The word polycystic is misleading. Those little cysts aren't actually cysts at all. They're immature follicles, i.e. eggs that didn't get released. So not every woman with PCOS has them, and not every woman with cysts has PCOS. Confusing? Yes. Misdiagnosed constantly? Absolutely yes. At the core of PCOS is often insulin resistance. So the body struggles to use insulin properly, leading to higher blood sugar levels, which prompts the ovaries to pump out more androgens. That creates the storm of symptoms. So you get irregular cycles, acne, weight struggles, unwanted hair growth, and alopecia. Oh, so it's not all in your head. It's not all about willpower. It's systemic. It's hormonal. It's metabolic. It's very real, and it deserves some real attention. So what's the lived reality of all of this? Okay, so let's talk about PCOS and what it feels like on the ground level day in and day out. It feels like buying yet another concealer because the acne just won't budge, and it feels like plucking the same stubborn chin hair out every single morning. It feels like hiding period products because your cycle is so unpredictable it could show up at any random moment, or not at all. It feels like wondering if you'll ever get pregnant, or if your body is permanently betraying you. It feels like being told just eat less, when the doctor or nutritionist doesn't see the bone-deep exhaustion, the wild mood swings, or the creeping depression that lingers. And it's not just physical, the psychological load is absolutely immense. So the rates of anxiety and depression are 3 to 8 times higher in women with PCOS compared to those without. Eating disorders are more common too. Why? Because when you feel trapped in a body that won't cooperate, shame becomes your constant companion. So PCOS isn't just a syndrome, it's an identity struggle. It's a war between what your body is doing and what you wish it would do. And most women are fighting that war in silence, feeling very isolated and invalidated. And nobody really fully understands this. The science of why still has question marks. So if we zoom in a little deeper, why does PCOS happen? So no exact cause is understood. It seems to be a mix of genetics, environment, and lifestyle factors. So for many women, the root is insulin resistance. So that's when the body doesn't respond properly to insulin, and the pancreas pumps out more of it. High insulin then signals to the ovaries to make more androgens, leading to disruptive ovulation and everything downstream. So it leads to irregular cycles, polycystic ovaries, skin changes, and fertility struggles. And then chronic inflammation plays a role too. Inflammatory markers are often elevated in women with PCOS, which can worsen the insulin resistance and ensuing hormonal chaos. Then there's the hormone imbalance itself. The luteinizing hormone, LH, to follicle stimulating hormone, FSH ratio is often skewed. Progesterone is low, estrogen fluctuates wildly, and androgens surge. What does that feel like? Think tired, moody, inflamed, anxious, bloated, oily skin, unpredictable bleeding. And here's what I always tell my clients. Your body isn't betraying you. PCOS isn't sabotage. It's your body waving a red flag. It's saying, my system is overwhelmed. My hormones are out of tune. Oh, please, for the love of God, listen. So understanding this science very much empowers you to respond with compassion and not self-blame and self-criticism. So if we talk psyche for a few moments, PCOS doesn't just attack the body, it attacks the self-image. So you have hair where you don't want it and hair loss where you do, acne where you thought you'd outgrown it, and periods that disappear for months. Infertility fears creep in. These symptoms hit at the core of identity, femininity, desirability, fertility, and womanhood. And shame loves to creep in. People will say, I'm not feminine enough, I feel totally broken, I'm exhausted, I'm less than other women. These are lies that shame whispers, but when society and medicine minimize your experience, those lies sink very deep. So what do women do? They defend with inauthenticity, saying I'm fine when they're not, by isolation of effect, so reporting symptoms without emotion. And then displacement, exploding about something trivial because you can't explode about your hormones. And here's the painful truth. Shame makes symptoms worse. Stress raises cortisol. Cortisol worsens the insulin resistance. The insulin resistance worsens PCOS. Remember, psyche and soma, the mind and body, aren't separate. They feed each other in a vicious cycle. And that's why therapy, support, and self-compassion are not luxuries. They're part of treatment. They're essential for breaking the cycle and reclaiming your sense of self. So what about differentiating PCOS from actual depression? So one common question I get is, how do I know if my low mood is from PCOS or if it's primary depression? It's a valid concern. Because PCOS significantly increases the risk of depression, up to 8 times higher in some studies. Let that sink in. All this due to hormonal imbalances, inflammation, insulin resistance, and the emotional toll of symptoms. But here's how to differentiate PCOS-related mood issues. PCOS will have issues that come bundled with physical symptoms. So you'll have the irregular periods, hair growth, acne, weight changes, and fatigue that's tied to metabolic factors. If your depression symptoms, such as persistent sadness, loss of interest, sleep disturbances, or suicidal thoughts, unfortunately, occur without these hallmark PCOS signs, it might be primary depression. Overlap is common. Both can cause fatigue, low energy, and sleep problems. PCOS depression may fluctuate with your cycle or worsen with symptoms like bloating or pain, while primary depression is more consistent and not tied to hormonal triggers. It's so important to visit your doctor and have a conversation if you're experiencing any of these things. And to sort it out, track your symptoms, journal your mood alongside physical signs and cycle patterns. please get comprehensive testing. Data matters. So get your hormone panels done, your blood sugars checked, and a mental health screening if you feel you need it. A multidisciplinary approach really helps. If you feel you need to see an endocrinologist for PCOS, talk to your GP and get a referral. And if you need a therapist or perhaps even a psychiatrist for mood, see them. Remember, these issues often coexist, so treating PCOS can alleviate depression, but don't assume one without ruling out the other. If in doubt, seek professional evaluation, and remember, early intervention makes all the difference. So what actually helps? So all I'm going to do is outline what other ladies have told me that has actually helped them with their PCOS. And remember, there's no one-size-fits-all cure. Management is possible through a holistic approach when you combine the medical, lifestyle, and psychological strategies. And everything that I'm offering is a suggestion that comes from people I've spoken to that have said different combinations or elements of this overview have helped them. Everybody's different though. Everybody is unique. So from the medical side, there are proven tools for some people. So metformin helps with insulin resistance by improving how your body uses glucose. Now, in my experience, some people find it very helpful. Other people say that they cannot tolerate metformin. It really upsets their tummy. Then the combined oral contraceptive pill. This can regulate cycles, reduce androgens, and ease symptoms like acne and heavy bleeding. Again, some women, it doesn't agree, it makes them feel worse. And then for hair growth and acne, some have found anti-androgen medications like finasteride that blocks excess hormones helpful. Again, others have not been able to tolerate side effects. So if fertility is a goal, ovulation inducers can stimulate egg release. And these are often used as first-line treatments. And in more complex cases, someone might see a restorative reproductive doctor. There are many in Ireland now. And if it's trickier, then they might have a consultation for assisted reproductive technologies like IVF. Everybody is different. Also, emerging options include GLP-1 agonists like semaglutide, which aid weight management and insulin sensitivity. They are showing promise in recent studies. Again, some people find them helpful, others cannot tolerate the side effects. And rarely, there are surgical options like laparoscopic ovarian drilling to help restore ovulation. And I would like to introduce a little known drug as well that a lot of people have found very beneficial, low-dose naltrexone. You'll see it online and talked about as LDN. So what's low-dose naltrexone and why would you use it in PCOS? So remember, PCOS is more than hormones. PCOS isn't just about ovaries. It's an endocrine, immune, and metabolic condition. So beyond the irregular periods and cysts, PCOS involves insulin resistance, as I've said before, and chronic low-grade inflammation, and sometimes it has autoimmune-like features. This is where low-dose naltrexone comes in. It works on the body's opioid, immune, and inflammatory systems. So what is low-dose naltrexone, or LDN for short? Originally, naltrexone was used at high doses, 50 milligrams up to 800 milligrams, for opioid and alcohol dependence. At low doses, 1.5 to 4.5 milligrams, it has a paradoxical effect. So it temporarily blocks opioid receptors for a short window of time, and then the body rebounds by increasing endorphin production. So remember, endorphins are not just feel-good chemicals, they regulate the immune system, inflammation, and hormonal signaling. So why does LDN possibly help PCOS? Well, firstly, we have the insulin sensitivity issue. PCOS often involves insulin resistance. Endorphins stimulated by LDN can improve glucose uptake and metabolic function. So some studies suggest LDN improves fasting insulin, weight stability, and appetite regulation. And then The issue of inflammation reduction. So PCOS is marked by chronic low-grade inflammation shown by elevated CRP and cytokines. So remember, LDN downregulates microglia and pro-inflammatory cytokines. This helps reduce ovarian and systemic inflammation, possibly improving ovulation quality. And then the issue of hormonal balance. So by calming inflammation and regulating insulin, LDN indirectly lowers excess testosterone. Endorphin support may also help normalize LH-FSH ratios, improving cycle regularity. And we have the autoimmune link. So some women with PCOS also struggle with thyroid autoimmunity, such as Hashimoto's. LDN has immune modulating effects that may be especially supportive in these cases, but it has to be very closely monitored because people have reported to me that oftentimes their thyroid medication, if they go on LDN, needs to be lowered. They don't need as much of it for some reason. So we also have the emotional and mental health effects. So LDN raises natural endorphins. It improves mood, motivation, and resilience. This is so important since PCOS is strongly associated with anxiety and depression. And there is an abundance of clinical evidence. So if you are pondering this and are thinking about going to your doctor and having a conversation or trying it, do your due diligence and your research. I would suggest looking up the ldnresearchtrust.org website, and there are 2 clinics in Ireland that prescribe for women's health. So Sale Nua Clinic and Neo Fertility Clinic. So there are trials and case reports showing the benefits for weight regulation, insulin, mood, and cycle function. You'll find them on LDN Research Trust. Most evidence is showing very good results, and it's often used by functional and integrative doctors, especially when standard treatments like metformin are poorly tolerated. So how is LDN used? So the typical dose is 1.5 milligrams, titrating up gradually to 3 to 4.5 milligrams, and it's taken at night. Now, I just want to make a little note here. A lot of women that I have had in therapy report not being able to tolerate 1.5 milligrams initially. A lot of people will get the liquid LDN and they'll begin on 0.1 milligram and they'll go up incredibly slowly. And essentially, there are a few side effects such as vivid dreams and sleep changes. They're the main ones that people report, or an upset tummy. And people have told me that by going really, really low and titrating up very slow, they haven't had any side effects at all whatsoever. In fact, a lot of people say, I don't know if it's doing anything. It's only later on a scan that they can see that it is actually doing something. So who might benefit most? Women with PCOS and insulin resistance, high inflammation or autoimmune overlap, those who can't tolerate metformin or want a gentler option, those with mood swings, fatigue, or inflammatory symptoms alongside PCOS, they might benefit from LDN. So what are the cautions and considerations? So it needs a prescription. It needs to be medically supervised. It's not a magic pill. It works best with diet, movement, and lifestyle. And it's contraindicated if somebody is drinking regularly or actively using opioid medication or other certain pain medications. You need to talk to your doctor about that. So PCOS is a condition of imbalance across hormones, metabolism, and immunity, and LDN may help reset the system from underneath, calming the inflammation, improving insulin, and lifting mood. It's not as widely used in Ireland yet as it is in the United States, and definitely it's widely used in the UK as well. But this is a very low side effect therapy worth discussing with a knowledgeable doctor. It seems to have changed the lives of many women that I have spoken to in therapy, and they love it. They found that it has been a game changer for them, which I can concur because I've seen a huge regulating effect on the mood as I work with individuals in therapy who are on it. I think it's really sad that very many people don't know about it in Ireland yet. And I know that local pharmacists have said to me that it is on the rise, the scripts that they're seeing coming in for it. And especially because at the worst it might not do a whole lot, and at the best it can actually be a life changer. So it's a low risk thing to try. So let's have a little look at lifestyle changes now. They're foundational too. So aim for a balanced diet to stabilize blood sugar, regular meals of protein, fiber, healthy fats, and keep your carbs very low glycemic index. Even a 5 to 10% weight loss can really improve symptoms. But I do tread softly here because weight is an issue for these women. But if manageable, a lot of people have done it on keto, the people that I work with, and they seem to have dropped a lot of weight, eating mainly protein and fiber and healthy fat, and incorporating weightlifting, strength training, walking, yoga. All of these boost insulin sensitivity. Sleep is hugely important. 8 to 9 hours nightly is essential, and stress management, especially breath work, can really, really help. And then you can talk to your GP or nutritionist about supplements. They can be very supportive too. Inositol, especially myo and D-chiro combinations for hormone balance, they can be very helpful. Vitamin D, check your blood levels first. Zinc, B vitamins, omega-3 fatty acids, they all reduce inflammation. And a lot of women I've worked with have found powerful relief from acupuncture. It seems to depend on the practitioner though. And some people have disclosed that they found taking curcumin really, really beneficial as well. There are studies on curcumin and PCOS. They seem to be in the early stages, but always talk to your doctor. So we won't forget the psyche. So therapy is incredibly important and helpful to tackle and dismantle shame, to grieve any fertility struggles, and to dismantle internalized blaming that can occur. I always say to people, journal. Journal, talk to yourself in your journal, map your cycles and symptoms, see the patterns, and that will gift you power. Community support groups are really, really helpful also. Very much help people to feel that they're not alone on their journey. And it's about effective management. If women can, with the help of a multidisciplinary approach, regulate their hormones, reclaim their dignity, do the very best that they can with the right tools, they seem to be able to live with it and live very, very well. It doesn't vanish, but PCOS is not just about ovaries, it's about identity, self-worth, and dignity. It's about walking into doctors' offices again, armed with knowledge and advocating for yourself, and, making a really, really strong request to be heard and listened to. So if you're balancing PCOS, hear me when I say this. I feel for you. You're not broken like all the women come in and tell me that they feel that they are. You're definitely not lazy. You're not making it up. You're fighting a very complex condition every single day, and I bow to you because that takes incredible strength. And if no one has said this to you lately, I do validate your struggles. Believe yourself, see yourself, talk to yourself, advocate for yourself. And I know how hard you're fighting. Hang in there. Talk. Keep talking and talk some more. So PCOS is the syndrome that makes women blame themselves for what medicine hasn't fully solved yet. But remember, change starts with understanding and advocacy. You're not weak for struggling with PCOS. You're incredibly strong and resilient for surviving it every day in a world that is finally starting to listen. So, a few things to reflect on, and maybe you can actually, journal on these questions that I have for you. Where do you feel most unseen or dismissed in your PCOS journey? And what small act of self advocacy could you practice this week? Perhaps asking for, a particular hormone panel to be run or different testing. Perhaps you could journal and challenge your own minimization of self, or you could share your truth with someone safe, or join a support group online or in person. How do you talk to yourself about your body? What would shift if you spoke to yourself with compassion and kindness instead of blame? And which symptoms feel the most overwhelming? And what's one support step you could take today, like, scheduling an appointment, going to the gym and beginning to lift weights, or, taking up yoga, anything at all? What grief has PCOS brought up for you? Grief perhaps around fertility, femininity, freedom? And how might you begin to name that grief instead of carrying it in silence? Maybe pick up the phone and call a friend or meet a friend for coffee and open up a little bit about it, safely and gently, instead of carrying it in silence. And if you like, you can go back to episode 30, where I outline the beginning of the psyche and cycle journey. And I hope you found this episode beneficial. So if this episode spoke to you, share it with a friend. And if you would like to be updated on when more episodes are dropped, just subscribe or follow. I'm Annie. Thanks for listening. Have a really great day. Bye.